Hello and welcome to Point 254. This is a podcast that looks at the US mission in Kenya through various lenses, from the departments to the different projects that they hold in Kenya. Diplomacy is often seen and unseen. We have various facets of it, and we'll hope that the stories that we bring to you will give you a look into that. Welcome to the show. My guests today are Brian Reitmann, the country coordinator of PEPFAR in Kenya, and Jerop Limo, who is an activist on the HIV and AIDS space. Welcome to the show. I'd really like to hear more about yourselves, and we'll start with a lady. Jerop, let's start with you.
Well, thank you so much for having me. My name is Jerop Limo. I am the executive director of a youth-led organization called AYARHEP, which stands for Ambassador for Youth and Adolescent Reproductive Health Program. And I'm a full-time, and I mean full-time HIV activist, literally quite passionate about the needs of our communities, and majorly with a huge bias of adolescents and young people, yeah.
All right, that sounds fascinating, and like you said, full-time, so it must be very involving.
Yes.
Okay. And Brian?
Great. And I'm the PEPFAR country coordinator at the U.S. Embassy here in Nairobi. PEPFAR is the President's Emergency Plan for AIDS Relief. And we've been here for about 21 years, working with the government of Kenya and civil society to really provide services for people living with HIV, trying to get as many people on treatment as possible and to try to prevent the spread of the disease. We've had great success here in Kenya. We're really close to the 95 goal of knowing that 95% of individuals who are living with HIV know their status. Of those, 95% are on treatment, and of those, 95% are virally suppressed. We're at about 97, 94 right now, so we're really close to it. And we're now starting to take a look at what's the long-term sustainability of the response, and how do we make sure that the gains that we've made we're able to sustain in years to come.
Okay. And I'll come back to you on the 95.
Very good.
It needs a bit of memory to remember everything, but we'll come back to it. Jerop, as a representative for especially the youth and girls, how has your involvement been, especially in the sexual and reproductive health space? It's been, 7 years now? Or more than
now
7 years? 8 years.
Yeah.
Okay. So as young people and having conversations with them, and we know that on the back of that is that Africa has the youngest population in the world, with about 400 million young people, and Kenya equally has a very young population. How active are conversations with the youth in this space and around this disease, especially in Kenya? Are they interested in learning about this? Are they interested in knowing more about their status? What does it look like really on the ground?
I mean, a lot of times we actually say there's paper and there's ground, right? There's what we hope young people would be able to access, as experts in the space, and then there's what young people would hope they could be able to access, and there's also what they are able to access. So I would say majorly in the space, it's been a progressive sort of journey where for the longest time adolescents were just the recipients, they were just beneficiaries, and now we get to work in a space where we are treated as equal leaders, so which is really nice, because then in many ways we get to influence decisions, and now that is the end where we say, young people need these programs, young people need these interventions, but majorly for us is to provide opportunities and environments where young people can access that information. I mean, we're in Kenya, we are an African country, so you realize HIV, reproductive health conversations are not conversations we are comfortable having at every setting, at family setting, at school setting. It's not a usual conversation. So for us in this space is to provide avenues and interventions that reach young people with this information, and majorly because many of them are interested. So we have a huge population of young people who are interested with knowledge and empowerment and skills, and they just don't know where to get it. So now we come in to provide avenues for them to access this. But also we have a huge number of young people who have information. It's not complete information. It's not comprehensive. So it's I would say it's not 100%, but young people are really interested in this. We just have to curate interventions that really meet them at their points of need, and then that information actually becomes relevant.
Okay, so clearly, as in all other spheres, the youth really want to be heard, want to make their own decisions, but on the back of that, they need the access and availability of information.
Yes.
What has been the challenge in accessing that information? Is it structural? Is it, like things like internet access, library access? What has really been the challenge?
I mean, I'd start by just talking about our social setting. Like I mentioned, these are conversations we're not willing to have. And majorly, like for me as a young person right now, one of my experiences and things I've learned in the space is that having reproductive health and HIV conversations should start at home. Because when this child is growing up, they should be able to access what we call age-appropriate information, right? By the time they transition into adolescent, then they have some level of understanding. By the time they get into high school, then by the time they get even to campus now, that is an individual who has information. But for us as African setting, the only thing your mother tells you when they realize you're on your period is that I should not see you with a boy.
Exactly.
But,
very strict.
Very strict and straightforward.
Yeah.
But what does that actually mean, right? So for one of the things that is so important is a huge barrier is our social and cultural belief as Africans, and we shy away from this conversation, but also policy barriers. It's been a huge issue about really speaking to adolescents about reproductive health and HIV. There's the basics we learn in class, but it is so vague and very basic, and you need profound understanding of this information. And of course, depending on your age, but policy really bars us from engaging adolescents who are in school and now who are bearing the biggest burden, actually. So there's policy barriers, but also really structural barriers. And I mean, young people are coming from different backgrounds, different environments. So you'll find young people in urban areas, peri-urban, and even rural areas. They all don't get to access the same level of information. And digital divide is also an issue. I mean, we'll do a podcast, but trust me, almost only 30% of young people in Kenya would be able to understand a podcast and listen and get information. So I'd really highlight cultural and social aspects, but also policy barriers, and majorly structural and economic factors. Yeah.
On that, Brian, PEPFAR has been here for 21 years. So they've seen the change, both positive and negative, of this journey. When it comes to that and looking at what PEPFAR has been able to achieve in those 21 years, what would your viewpoint be on that? What changes have you seen in culture? What changes have you seen in policy? And how involved are you in policy? And then what are the structural barriers that you're maybe trying to address in your work?
It is something where we have to continue to evolve because the situation evolves, and the youth that we have now are very different from the youth that we had 21 years ago. Also, the concept of HIV within the culture has really changed within those last 21 years. 21 years ago, HIV was seen as a death sentence, and it really was a challenge, but people were more engaged and they were more, the fear that was around it was actually allowing them to have more thoughts of prevention. currently, when we talk with youth, they're more concerned about jobs, more concerned about getting pregnant than they are about HIV. And that's part of the challenge of our own success is that we have brought new infections down to such a low level that people don't have to be as concerned about it. But we do still want them to be knowledgeable and understanding of the consequences of what they do, so that they're packed with the knowledge to be able to protect themselves, whether it's for HIV, STIs, or other challenges in life, including pregnancy. So I think it's really kind of evolving our messages around that to really make sure that people are listening, because if it's just HIV, people are going to tune it out because they don't have the same risk perception that they did 20 years ago. And that's okay.
But that you've actually said that risk perception. It's true that a lot of I will include myself in this. A lot of us are more afraid of being pregnant than contracting an STI or an STD. And like you said, part of that is because the programs have been so successful. The fact that HIV is not taken as a death sentence anymore. It's a manageable disease. It's the interventions that have been in place. But from your perspective, Jerop, how is the youth coping with that risk perception? Are they absolutely ignoring the risk that they're putting themselves in? Or are they just glad that there are interventions? If you do have HIV or AIDS, you are able to then live a fulfilling life and not be so afraid. It's not a death sentence. Because what we saw in the 90s, even the messaging around it was too scary, you know? Like you absolutely knew there's no way you should contract this disease, because if you did, that was the end for you. What is the perspective of the youth now?
One of the most interesting things is they fear pregnancy because pregnancy will be seen. It's an outward sign. Yeah. People will see.
And there'll be a product.
So, of course, they'll know I had unprotected sex. Yeah. But HIV is not written on your face, right? But also, really, it's because they don't understand the other side of treatment. Times have changed and science has evolved and treatment is way easier right now. And we've made so many advancements. But to be honest, it is still a difficult journey. It is still a difficult journey. So young people would say, it's just taking a pill. It's just taking a pill.
Because it's down to...
it's just down to
one pill per day.
From a conversation we had heard earlier, Brian, it was about 17 pills back in the day.
Multiple times a day.
Multiple times a day. I don't even want to remember my own journey. But young people don't... I constantly say that their risk perception is almost zero. Young people will see the hole after they've entered that hole, to be honest. They don't really perceive that risk.
YOLO?
Yeah, you only
and then
live
deal
once,
with the consequences later.
And that's why information allows them to perceive beyond, because young people, we look at here, we don't look at
today,
after. I want to go out, I want to have fun, I want to have a boyfriend, and it's all okay, it's all fine, but there are always consequences after. But the idea is there are different sets of young people. They're very diverse, right? The young people who, due to vulnerable reasons, will find themselves in vulnerable situations. There's also a set of young people who just wants to be young and enjoy life and live life.
As they should.
Right? So the idea is to help them to see that risk, but also to think about it in a way they can protect themselves or prevent themselves in an instance where they're exposed.
And the good news is some of the same interventions that can help prevent the spread of HIV help prevent pregnancy.
Yes.
So
it's a double
loop. If you use a condom, it actually works.
Integrated interventions.
So they should just be able to get the information, understand it better, then make their decisions, informed decisions. When we're looking at that cultural aspect, there's the barriers like we spoke about, but most of it is actually just more about who we are as a people. And I know that culture takes sometimes very long to evolve. Stigma has reduced for sure. We no longer see that a person who has HIV or AIDS is someone we should avoid, someone we should not touch, someone who we should not interact with. Like you said, it's not written on your face, so you wouldn't even know anymore. And maybe Brian, you'll have some information and data on this. When it comes to gender and statistics, how do you think the two genders are faring in terms of infection rates, in terms of accessing healthcare, and also just being able to understand this disease? What would you say about that?
One of the challenges we face, and this is since the dawn of public health, is getting men to go in and see doctors. So, getting them to access health services is a challenge. And that really plays out in the HIV arena quite substantially. Overall, I think it's around 2/3 of HIV infected are women. But those men are the ones who actually are not going into services as much. There are quite a few that are there, but we also see there's a lot of people men who come in for services and then leave and don't necessarily stay on drugs on the treatment regimen. So it's making sure that they come in and making sure they stay on treatment, and then once they're on treatment, there's the U equals U. Once you have your viral load goes down to an unmeasurable number, you are not able to transmit the virus, and so trying to make sure that they understand that and that they are then really making sure that they're protecting their partners in that way, I think is really critical. So I think that those are huge elements and ones that we want to try to get men particularly out. With new infections, we see quite a bit of youth in new infections. I think over half are with youth. But we know that those youth, while the prominent number of those youth are female, they're being infected from older men. And so it's trying to understand how those dynamics work and trying to stem them as best we can.
So there's still a lot of work, I guess, to be done in behavior change. Like you're saying, if the infection is coming from older men and to younger women more than anywhere else, it's maybe understanding why the two parties are in that position and why they make those choices. And
quite often that can be economic dynamics.
And I would assume so, yeah. And of course, with a lot of people being in vulnerable positions where then they don't really feel like they have a choice to make any other decision.
Exactly. And then that comes back to when we talked about what people were concerned about, getting jobs and getting pregnant. If we
jobs is more important.
If we have economic empowerment for those young women, it actually provides a benefit for them so that they're not seeking sexual, whether it's providing sexual services as transactional sex or just in their normal interactions.
What is your experience on this? Do you have a viewpoint on this?
No, I mean it's actually true, because when girls, I sometimes I say I don't like the fact that we are very vulnerable as young as girls, but also just thinking about even gender-based violence and all these issues that young women especially really face, and the lack of, I call it lack of autonomous, or rather lack of power to make autonomous decisions about their health. And like Brian is saying, men for the longest time, getting them to see a clinician or a facility has been quite difficult, right? But a woman will get pregnant and she has to go to the facility, and a HIV test is a must. And here she is, she's just been tested and the test is positive. And she doesn't know where it happened, where she got it from, whether it's from the partner. But now she's in a position where she's infected already, and now she has to figure out the child. So I feel like there are very many aspects where women are not able to be in charge of their lives and their health, and they're not able to make even decisions around safe sex or negotiate for safe sex. And I mean, that's why programs like Dreams exist, so that we're able to empower women. They can have that ability to make autonomous decisions about their health.
You've mentioned Dreams. Tell us a bit more about Dreams. You seemed very passionate about it.
Yes.
Yeah, the Dreams program is one of the programs run by PEPFAR. Such an incredible program that really focuses on holistically empowering women and young girls. And I mean holistically because you're not just looking at HIV, because like Brad mentioned, sometimes you talk about health and people, their problem is not health.
Yeah.
Their problem is that they need a job, they need to go back to school, they need food, just basic stuff that put young women in vulnerable positions. So the Dreams program focuses on supporting young women and girls in vulnerable communities in different aspects, but majorly based on what you as an individual need you have. So for example, I would come in, I dropped out of school, I'm pregnant, and I'd have the opportunity to say maybe I need to go and study and do like a course or open a salon or start a business because maybe I don't want to go back to school. So there are this variety of options that you can be able to be enrolled into because then you don't want someone shouldn't decide what would work for Jerop. I should be able to. But majorly is giving me information and skills and empowerment, because one thing I believe in is that being able to make the correct choice needs a skill. It's a skill in itself. So you go through a series of trainings, you have mentors, but also you interact and meet a community of other young women who are part of the program, and you're part of this program for a couple of years until you're in a stable position, right? And you can open a business and there's support for that. There's really a lot of, it's the best definition of what a holistic program really is. Yeah.
All right. And Brian, to you, what does PEPFAR do for community-based programs? Because clearly they're very important, and we know that as an individual, it matters where you fit into a community. And sometimes interventions are actually best led by the community themselves, and they're able to address their problems and their issues much better because they are in the community, they understand their situation better. Could you give us some examples of such?
Sure. We work quite extensively across the country, working with really local organizations. And so our partners will sub within the locality for small community groups to be able to provide those services. And sometimes it's with community healthcare workers directly, sometimes with organizations in the counties where we work. And as you mentioned, it is really critical because they're the ones who are actually experiencing. They're the ones who actually know what's going on. And so at that local level, we work very, very closely to make sure that they're, one, providing services. Two, we've also been working on community-led monitoring, which we've supported several local NGOs to go out and take a look at sites and say, okay, what's going on here? And talk with the patients and really identify what are some of the challenges that are going on at the local level, understand where there's stockouts of certain drugs, and understand what the patients actually want. So we're really in the starting stages of that, but the initial reports that we're getting have really been helpful within the facilities, and then bringing that up to the county level so that the county level officials understand what's going on and can make changes. And if it needs to go to the national level, we do that as well. And then we do also have a good deal of support that comes in at the national level for the civil society that, as Jerop knows, that as we have advocacy programs, we want to make sure that we're listening to them and so that they can really guide us on how to make changes in the long term. I think that's really coming to bear as we're talking about long-term sustainability, and how we are going to be able to integrate our HIV services under PEPFAR, which has been a very siloed program, more into the UHC and PHC strategy that the government has, so that people can find services outside of the CCCs that we've set up.
What are CCCs?
So
Comprehensive Care Centers.
Thank you. I lost.
Sorry, Comprehensive Care Centers.
Okay.
Yeah.
Okay.
So those comprehensive care centers are set up mostly within public facilities, but also some FBOs, faith-based organizations, have comprehensive care clinics as well, and that's primarily where individuals who are living with HIV can go to seek services, to get treatment, but other services as well. We're now looking at trying to diffuse that out so that most doctors will be able to see HIV patients and be able to prescribe drugs in a way that is much more conducive for the individual, so that they don't have to go out of their way to find these CCCs. However, you mentioned stigma earlier. Stigma still exists. And so we want to make sure that we're making services available how individuals want to seek them out. And if there is still stigma within those local environments, some people may want to go to another city or to another town to be able to seek those services out. And we want to make sure that that's available. But while also setting up a digital platform so that we understand if the patient is going from this clinic to that clinic, we know that they're going there, and we can understand how those dynamics are working.
Okay. So it's very grassroots led, where anyone can find those services at that level, but of course building up to the regional and national networks.
Exactly.
Jerop, you sit as a board member of the National Network of People Living with HIV in Kenya. How has your experience been representing the youth at that level? And you also sit at the board of the National Network of TB Champions in Kenya. Do you feel like those kind of national bodies are making an impact for the youth and for the general population too? What has your experience been?
So my experience has been actually great. And one key aspect in this space is the multi-sectoral sort of engagement that we have, where we're all partners in this space, right? And a lot of the work that we civil societies do is quite impactful, I would say. And we really envision to, even as we sit at national spaces and at regional spaces, that we're able to bring out their voices, because what we do is really co-represent. I don't speak for myself, I speak for the young people who have these needs, who are experiencing these challenges. And if I get an opportunity to sit at a board, then I'm able to say, we need this program for this county, we need young people to join this training, we need this event for young people. So they have been immensely impactful, because right now, young people, we are not just sitting at the end, or we are not outside the door and older adults get to sit in a room and decide what should work for young people. But we're actually in the room really speaking on behalf of young people and saying, this won't work and this is what would work. And we get a listening ear, but we also get to see all those things actualized. Like Brian said, it's not this cannot be a one people job. It can never be. It requires all of us. And when I think about it, because young people are bearing the biggest burden, everyone is trying to figure out, how do we support young people? How do we work with young people? So for me, it's organizations and networks that sit at the national level providing avenues for us young people to sit at decision-making tables and really influence those decisions that favor us. Yeah.
Okay, so as we wind down, I would like to get, we'll start with you, Brian. I mean, PEPFAR has been here for 21 years, and you work with so many partners, I think over 100 within Kenya. What would you say have been, one, your greatest achievements, and then two, what are you looking for in the future? What are the goals maybe for the next 5 years for PEPFAR?
Sure. I think the greatest is, as we mentioned, that 95
yes.
before. If we can achieve that, we consider it as epidemic control, but that's a a name. Yeah. But the reality is, the amount of new infections that are reducing so substantially from when we first started, and the number of deaths that have substantially reduced, we really put it as a great success. But I think
just to give you the statistics, I read that the infections have fallen by 59% and deaths lowered by 57% for Kenya.
Yes.
Yeah.
And, I think that those numbers may be even greater depending upon the time frame that you're looking at. But I do think it's one that as we look at that, I don't want to just cite the statistics.
Yeah.
I also want to think about the individuals. And so when you're talking with people, like it's just such a huge change of mindset that you have with individuals who are living with HIV, from when we first started, because it really was seen as, I don't know that I have 5 years left. I don't know that I have 2 years left. Now people think, who are living with HIV have a full life. It may not be the best because we do have still have, as mentioned, there are still some side effects to the medications. But it is a full life that you have ahead of you, as opposed to years before. So that mindset is really what I think is the biggest success, aside from all the statistics, which I think are great, which we need to continue to come back to. And then as we look at the future, I think it's starting to take a look at, as PEPFAR is starting to wind down, because the reality is we've gone down in funding over the last 5 years, about $200 million per year, down to about $300 million. And that trajectory is probably going to continue. And so it's now trying to find a way to make things more affordable so that the government of Kenya and the society of Kenya can take more and more on over the next few years, but not doing it in a way that's just like, signing off, saying, okay, we're out, but really changing it so that it is the way that the patients want to see it and that it's affordable for everyone to be able to continue. But doing it in a really, in a graduated way, so that we're not just turning the lights off. In a very sustainable way, yes.
Yeah. Okay. And for you, Limo, what do you, as a youth representative, then, what do you hope for the future, and what do you think the youth are able to then look forward to and to achieve?
I mean, one key aspect I think I look forward to is the many successes that are yet to come. And like you mentioned, science is evolving so quickly, and very soon we'll say we don't have a pill, we can use an injection. So those are things I really look forward to, but also being able to continue the work that has been going on for so many years, ensuring that we're able to sustain the programs and interventions, because they are very, very important. We want to ensure that young people have access to information, enabling environment, but also really they're able to access quality healthcare services, because that's very, very important. So those are things I really look forward to. And also a society that doesn't shy away from health conversation, because for the longest time we wait until we are sick is when we want to discuss about our health. So for me, it's empowering young people in our communities to realize that our health is important. We need to take care of ourselves. We need to be cautious. As we're enjoying being young, you need to always protect yourself. And you also don't want to put yourself at risk, but also really equalizing or creating an environment where the stage is balanced, where communities are viewed as equal experts, partners are looking at us as key stakeholders in the space, and we're able to work together, not only with development partners, but also our government, because like Brian mentioned, we are thinking about sustaining the response beyond 2030. And for me, what that looks like, to be honest, it's a bit scary, because I'm like, what will happen then? But at the same time, I feel like there is a huge ability for our own government, for our own country to be able to take on this mandate, and I look forward to contributing to this process and ensuring that our communities and young people are able to access quality healthcare.
All right. Yeah. Any last words? Anything else you would want to add on, just in case?
Just I want to thank Jerop for her candor. In every meeting, she's always been a voice of reason as well as hope, and I think that it's really great to have that voice of youth empowered and really in the room for those discussions. So so that they're really setting the stage for what's happening in the future, so that us old people can
I mean, the leaders are here. Tomorrow's leaders are here.
Exactly.
So you're making the decisions now, but you'll be able to do it also for when you're also at that point.
Yeah. Thank you so much, Brian. I mean, we are leaders of today, actually. So we just look forward to occupying Brian's positions
Spaces.
and those big spaces when they leave, so that we can continue and make sure we sustain the gains that we've made so far. Yeah.
So I guess then maybe the joy is that you've already started the work.
Oh, yes.
So in as much as PEPFAR and it's thinking of scaling or might be forced to scale back, we do have people like you who are leading the charge. So we're in good hands, I think.
Yes, I trust.
All right. Thank you very much. It's been a pleasure having you here and learning more from you.
Thank you.
All right. Thank you, everyone. Today's episode has been very interesting. I hope you've learned as much as I did. Thank you, Brian, and thank you, Jerop. That's it for today. Bye.